Absolutely. So thank you so much for having me today. And thanks everybody for spending your Saturday with me today. This is a presentation that I actually gave at the National Eczema Association Expo, and it's called The Rhythm is Gonna Get You, and it's all about circadian rhythms. So I'm going to open up my presentation. You can just give me a second. This always takes me a little bit of, okay, and then I'm gonna get this to, why is it not letting me share?
You're sharing. We can see it.
I am, but it's got like everything on it, right? Not just the, there we
Yes.
go.
Just like
Here,
the
let me do
presentation
this.
mode. Yeah.
Okay, hold on one second. And then let me do this. And then now it's the whole page, right?
Yep, it worked. Yep, now it's perfect. We can see it just right.
Okay, great. So I really am interested in this particular topic myself, and I'll tell you a little bit more as we go through it. So I'm going to be talking about how the circadian rhythm actually affects your eczema and your well-being and vice versa. So let's get started. Okay, so what exactly is a circadian rhythm? Essentially, it's the inner clock that basically runs all 24 hours of the day. And it's the thing that actually regulates all the different things that your body does each day, whether it's sleeping, hormonal production, your body temperature, your metabolism. And the way it's actually influenced is by the amount of light that you get, the amount of darkness that you have. And just about all living organisms have this in their system. And what's interesting about traditional Chinese medicine, which I am a practitioner of, is that we base just about everything that we do on circadian rhythms. Because the way we look at health is we think of it in terms of as long as you're in harmony with what your natural rhythms of the day are, you are probably having optimal health. And that's how we came about with this idea of yang and yin, or yin and yang, however you want to talk about it. Yang always talks about the daytime energy and the high energy that we have. Yin is all about the restfulness. So that's how we got this symbol here. And what's even more interesting is we blocked out the entire 24-hour clock and figured out like all the different organs and what actually is peak function for each of those specific organs throughout the day. So it's in 2-hour increments throughout the 24-hour day. You have every single different organ there. Now, I will say the organs are slightly different in terms of how we interpret them and what they're responsible for than what we say in the Western world, but there's a lot of similarity. But the bigger picture and concept to understand here is that we feel like in Chinese medicine that if you start to detach from all of these regular cycles throughout the day, that's when you actually start to have disease. So this is something that started way back in the day, and now we're only starting to really understand it in terms of science. So how does it really work? So how it's controlled is something called the suprachiasmatic nucleus. We'll call it the SCN from here on out. And it's in your brain's hypothalamus. And what it does is it regulates how much melatonin you have and how much cortisol you have. And so, as you all probably already know, melatonin is your sleep hormone, and it increases typically during the hours that you have more darkness. And then cortisol, which is actually what starts the stress response, actually tends to peak in the morning. So all of these different influences of melatonin and cortisol depend actually influence like what's going on with your immune function as well as skin regeneration. So let's just take a look at that. So there's actually many different types of chronotypes, or a lot of different types of ways that this functions in our bodies. And so it's really determined by our genetics, and it can change as we age. So, for example, you probably know a number of people, or you could be one yourself, somebody who's really energetic in the morning, but maybe kind of tired as the night starts to start. Or maybe you're somebody who's more of an evening person. You're really alert at night, maybe not so fast in the morning. And so we call those people the owls. And the people who wake up earlier in the morning and are really energetic, we call them the larks. And then maybe you're somebody who's sort of in between. You're kind of energetic in the morning, you kind of have energy at night. It doesn't really lapse between the day. And so we call those people the hummingbirds. And that's something that's kind of in between. So there's a lot of different types, and the reason is why we have all these different types, because way back in the day, our species, human beings, had a better chance of survival if we actually had somebody who was guarding against any invading enemy or a wild animal or whatnot. So there tends to be more people who are sort of in the middle or a little bit more of those people who tend to be night owls in the full spectrum of all human beings. So if you want to take a look at this graph, it kind of shows who tends to be morning people, who tends to be evening people, who's in between, and the bell curve kind of is a little bit more to the right, to the evening, and it's all because of what we needed in terms to survival. Okay, so let's talk about how do the circadian rhythms actually impact eczema and vice versa. So some of the things that we already know is that there's a lot of different things that actually change throughout the day based on your circadian rhythms. And this is how it impacts the skin. So during the day, that is when your skin has the highest skin protection. It also has the highest sebum production. It also is when your skin is actually the thickest. And then as we get closer to nighttime, that changes. And that's when the highest blood flow happens, the highest water loss, the highest skin temperature, the highest skin acidity, the highest barrier permeability, and also the highest skin cell regeneration. So what does that translate to? So what this says is nighttime, the skin is the driest. And I think a lot of you already know that. You know, when you wake up, you're like, gosh, I have to use so much more lotion. And the reason is because you're not producing as much oil at nighttime. Um, and while there's more blood flow, you have a lot of these pro-inflammatory molecules that are reaching its peak. Also, transepidermal water loss is the highest in the late afternoon and the evening. So that's why you tend to be drier and drier as the day goes on. And that leads to a more compromised skin barrier. Okay, so what does this mean in terms of the body temperature? So typically, in a quote unquote normal person, what happens is that your body temperature fluctuates throughout the day. So the lowest temperature tends to be early in the morning when you wake up or just before you wake up. And the highest point occurs typically in the evening just before bedtime. And then it usually drops somewhere during the night as you're trying to go to sleep. And so I think if you look at this, this will look very familiar to a lot of you who are kind of wondering, well, how come I'm itching more and more as the day goes on? And how come there's a certain point in the middle of the night where it sort of cuts off? This is the graph that explains a lot of that, but there's more. Okay, so eczema also affects your body temperature's control systems. So we already know that there's some thermal regulation issues that happen when you actually have eczema, right? And so typically a normal body, quote unquote, if you go through this little chart here, you can see that the body temperature, when it falls, what happens is the blood vessels typically constrict, and then the heat is conserved. And then what happens is your sweat glands do not secrete any fluids, and that makes you be able to shiver, which allows you to generate some heat and then keep that warmth in your body. So that way the heat is retained and you go back to regular body temperature. But if your temperature rises, the opposite happens. So your blood vessels are going to dilate. That'll allow you to have some heat loss into the environment. Your sweat glands are going to secrete fluid. That fluid, as it evaporates, more heat is lost from the body, and then your heat is lost into the environment, and then you kind of cool down and you're back to normal body temperature again. But that's not always what's happening when you have eczema, because what happens is your eczema disrupts the skin barrier, so it impairs your ability to retain moisture and regulate heat. And then the stratum corneum, which is the outer layer of your skin, it actually becomes thinner, and then it's more permeable in eczema patients, and it makes it much harder for you to maintain a normal skin temperature and respond to heat or cold. So I think a lot of you who have these kinds of issues, and I see it a lot in people who have TSW in particular, is that they really have a hard time like having a normal temperature based on what else is going on in the environment. Okay, so because of this dryness and because of this inability to thermoregulate, guess what? That actually adds to more itching. So we found in a lot of studies, and this one in particular that I picked out in 2024, it showed that itch in eczema patients follows the circadian rhythm between 8 to about 12 o'clock at night. It's the highest, and it's the most severe. And like 4 in the morning to 8 in the morning, it typically is the lowest. And guess what? That's usually when people sleep the best, right? So, for all of you who are wondering, oh no, I think it's because I'm distracted during the day and I'm not so distracted at night. This is the real reason why your itching tends to be a lot more during nighttime. All right. So not only are we having more itch at night, but because of that itch, it's also disrupting our sleep, right? So it makes it a lot harder to fall asleep. If we actually can fall asleep, there's a lot of tossing and turning, there's a lot of restlessness, or maybe we're even waking up multiple times a night, or maybe we're not even sleeping at all and we don't fall asleep until like later in the very, very early parts of the morning. And like that bell curve showed you, or that curve that I showed you earlier, your body temperature is at the lowest, and that's typically when people fall asleep or have the best chances of falling asleep. Okay, and then let's add one more layer of stuff that typically happens when we have eczema. There is always some amount of stress, right? Or even some stress that's coming from your life or your job or whatnot, externally. So whenever you have stress, your body is now releasing more cortisol, more adrenaline. And because you now have increased cortisol, it's going to suppress your immune system. So eczema patients have an overactive immune system, and then the suppression leads to inflammatory responses in skin. And guess what that means? More flares. So just to put that in a really simple diagram, obviously you guys are really familiar with this. Eczema always gives you more stress and anxiety. It then gives you more disrupted sleep. Whenever you have stress, you have increased eczema symptoms. When you have increased eczema symptoms, you have disrupted sleep. When you have disrupted sleep, you have more stress and anxiety. So it's this constant circle of things that are, happening as one thing continues and it causes all the other things to happen again. Okay, so let's talk about now we understand like how eczema is actually affected by the circadian rhythm, but there's so many other things in your daily life that is also throwing off your circadian rhythm. And I want to kind of give you some idea of what those things are and what we can actually do about it. Okay, so, as we already know, the more light that we see, the more we're able to control the circadian rhythm. So, I want to just point out that, I mean, there's can sometimes be a misunderstanding, like some days, like maybe gray, or maybe you go to a movie theater and you're in the dark. Like, is that affecting my circadian system? And that's not necessarily the situation. So, what's important is what time of day are you actually seeing light and what time of day are you actually seeing darkness? So if you see darkness in the morning because you're seeing a movie or whatnot, that's not really going to throw off your circadian rhythm unless there's other things that you're doing as well. So as long as you're getting enough daylight during the day, whether it's a blue sky or even a gray sky, that can actually protect you from other issues at nighttime and blue light in particular. And I'm going to get into more detail about all of these things. So just remember light during the day, darkness during the night, and that's the optimal situation. So these are the things that kind of throw things off. So windows actually have what they call low emissivity coverings on them now. And so what that essentially does is it's trying to help you have a lot less heat come into your windows, but you still get some amount of light. But it's actually changing the kind of light that actually comes through your windows. So it actually intercepts 70 to 85% of the circadian stimulating light. So how do you know whether or not you have low E windows? Well, what you can do is shine the flashlight from your smartphone onto the actual window and see if you see like this colored reflection. It can be sort of like a bluish, greenish, or sometimes it's a little red at the beginning and in the back it's like a little bit different color. If you can see that kind of coloring when you shine a light on it, you most likely have low E. And to be honest, I don't think they really make that many windows that don't have it anymore. So chances are that you have it. The windows are one of the reasons why we're not getting as much of that kind of light every single day, even though we might feel like it when we look at our windows and we go, oh, we're getting all this light. And we're like, well, actually, we're not. Okay. Sunglasses. They actually can block up to 100% of the UV light that we get in and the blue light that we have. Um, so what's really important is that you want to get as much of that, natural light into your body so that your circadian rhythm clock can continue. So a great recommendation would be try not to wear your sunglasses so much in the morning. Let your eyes get as much of that light as possible. And then as the day goes on, you can put the sunglasses on. Okay, LED lights. So this is a really great chart because it really helps to explain like what kind of light spectrum we get from each of these different things. So when we talk about light, oftentimes blue light is the one that is the most disruptive. And what we want to do is kind of see more of the red light so that we don't disrupt that as much. So if you look at this chart, this will show you what actually happens when you use different types of light. So when you have an LED bulb, you can see like there's this huge amount of blue light that comes out. And guess what? It actually suppresses the melatonin by 80%. Like that's huge. When you look at a compact fluorescent lamp, you see this blue here, still again. It's approximately 80% suppression for melatonin. But look what happens when you actually use incandescent bulbs. You see how there's like so much more red spectrum light that comes in versus the other two. The other two are more heavy on the left side, and this light is more heavy on the right side. This only suppresses melatonin by 40%. So those are the regular light bulbs, not your LED ones. And then look at the candle. The candle is like so much more red in general. And it only suppresses melatonin by 2%. And I'm not necessarily saying that you should change all your lights out to be candles, but it's just a way to compare all these different light sources and what actually happens. If you happen to have those candles that are those OLED lights, they're less than 2%, believe it or not. So that's kind of a nice thing to use. Okay. So here's another great chart that kind of shows you where you want your light spectrum to kind of be. And, anything that's like on the left side of this yellow is sort of the one that is causing you to have more of your circadian rhythm to be unbalanced and kind of thrown off. And anything that's a little bit more right of this yellow will do better things for you. So when you look at the LED lights, there's the ones that they call the cool light. The wavelength that tends to be is like this 450 to 500. So you're looking at like this purple blue area. It's very blue rich, and so it's very strongly melatonin suppressing. If you do the warm white LEDs, they're better. They're actually in the 550 to 600, but they're still not quite completely over on this side. But they are a better option and they don't disrupt as much. And then here we are in the incandescent light. And this is really on that other side with the 650 to 950. It's already over in this black area that's not even being shown. A lot of red and yellow rich light, very little blue. And so it's got minimal melatonin suppression. So one of the things that you might want to think about is use your ceiling lights during the day and then the incandescent and the warm white lamp lights at night. So if you have like those poles with like lamps with, those kind of light bulbs coming at it, that's probably a better option for you than, all the lights that you have above you, which typically are more of these LED lights. All right, here we go. Screens. So I know a lot of us are guilty of this. And at night, it really comes to be a big problem because screens are like almost all blue light. So it really suppresses melatonin production, which is, what's affecting our sleep a lot. So the rules of thumb that I found were that the best way to go about using electronic devices is to cut them out like 90 minutes to 2 hours before you go to bed. Try to use those blue light filters and those dim screen, and then try to dim your screen so it's not so bright. That way, at least you're not getting as much if you absolutely have to be on the screen. An even better thing to do is like try to get those things out of your life, a couple hours before you go to sleep, and maybe instead read a book or stretch or do something else that actually helps, produce the melatonin. And the other thing that's super important, as I keep trying to mention over and over again, is expose yourself to as much bright light during the day, because that will actually help to combat any blue light that you're seeing at night. Now, that's not to say that you should go outside for 8 hours and then you can do all the blue light you want. There's still going to be a balance. Okay. Um, I wanted to know, how helpful were these blue light blocking glasses, particularly if you use them before bed? And a lot of the studies that I found were really very inconclusive. And the reason was because most of the studies were using populations of people who struggle with sleep versus like the normal average person who's not really having a lot of problems. So it was very difficult to kind of separate out, what was actually happening with these people. And so as a result, the other thing that they found is that the coatings that are actually on these glasses, they're not standardized. So some glasses have a little bit more, some glasses have a little bit less, and they're not really marked to tell you what exactly it is on the spectrum of, coatings. So it's very hard to know. Um, so what I would say is if you absolutely have to do screens at night, what you might want to consider as being more important than whether or not you have these blocking glasses on at night is what kind of content are you actually reading? Because it seems like if you're stimulating your brain more at night, then obviously that's sort of not helping the production of melatonin as well because you're a little bit more amped up. So if you wanted to have more, calming kinds of things to read, or the kinds of things that you're taking in terms of videos and whatnot, that's probably a better way to go than just completely relying on blue light blocking glasses. Okay, everybody's favorite, caffeine. Um, Everyone kind of wonders, like, well, how much is caffeine really, really affecting me? And believe it or not, it really actually affects you a lot. Even though you take a very small amount, it can actually delay your actual REM sleep and it can reduce the overall accumulation of sleep that you have. So it can really block a lot of things. It's blocking your adenosine receptors in the brain, which keep you kind of, revved up. So I wanted to put together a little chart that kind of gave you an idea of what each of these different things that we can drink actually has in terms of milligrams of caffeine. And as you can see, Coke and Diet Coke, they're sort of on the lower end, which I was actually surprised to see. But I guess nowadays we have so many things that have, five times the amount of caffeine that I shouldn't be surprised. And then we get to tea, and that's like 47 milligrams. But we could do a big jump when we go to coffee, 1 cup of coffee, and then Red Bull. Apparently Starbucks Americano, I guess it has espresso in it, so it has even more caffeine. All these different power drinks that we have. I mean, it's kind of scary, like when we get to Celsius, like how many milligrams we're talking about. So the rule of thumb is that you really want to stay away from this stuff 4 to 6 hours before bedtime. But I will say, in addition to that, if you're drinking stuff that's on this side of the graph, the higher powered drinks here, I would say you even want to have um, more time because it's not just about getting the caffeine in and out. It's like the amount that you're actually taking in too. And it takes your body that much more time to actually process all of that. So if you're drinking on this side, you might even want to think about 12 hours before bedtime. And I guess it depends on how many you're actually drinking per day too, not just one. Okay, let's move on to the next thing. So, alcohol, believe it or not, that actually disrupts your sleep patterns. And I know a lot of people say, oh, but it helps me get a little bit more drowsy so I can fall asleep better. But believe it or not, when you drink alcohol, you actually have more awakenings during the night and you have much less REM sleep. So, I kind of looked into this a little bit more because I was really curious about this. So, I actually got one of these wearables so I could have a better sense of like what was actually happening to my sleep. And I actually put in every single day, like whether or not I had something to drink, whether or not I had coffee, whether or not I would had whatever. And then it shows you what your sleep is every single night. And I was amazed that how much a little bit of alcohol completely changed my sleep patterns. And while this says about more awakenings, most people say, "Oh, I don't wake up when I'm drinking alcohol." Well, it's not so much that you become conscious and you're getting up. It's these in and coming in and out of your REM sleep and your deep sleep. That's considered an awakening. And believe it or not, like every single time I've had any amount of alcohol, even just like a drink or two or whatever, the number of awakenings skyrockets, and the stress of my sleep is just like this huge crazy line instead of this flat line during the night. And so I've been playing around just to see, is it one drink? Is it, several drinks? Like which one like really makes that impaired? And it's really kind of sad because it's any amount. So the rule of thumb is avoid alcohol at least 3 hours before bedtime. But I will still say that I have done that and I can still see the stress of my sleep is just like really, really off. And the amount of REM sleep I get and the amount of deep sleep I get is definitely impaired. I just did this experiment last night just so I could report on this. And I had a few drinks and I figured, okay, I stopped at 9 o'clock. I went to bed at 12. I slept until 8. You would say, okay, you got your 8 hours. That should be good enough, right? Well, I looked at it and the 8 hours were horrible. I had like 16 wakenings. I had the stress was just like nuts like this. And the night before it was just a flat line. So it's really amazing what a big difference alcohol does. So anyway, try not to have as much before you go to bedtime because that definitely will impact your sleep. All right, eating close to bedtime. So believe it or not, heavy, fatty, and spicy meals actually cause you to have a lot more of these wakenings. And again, I'm saying wakening in terms of what your body is coming in and out of your sleep waves, not like you actually having your eyes open and getting up. So it's what happens throughout the night. When you have simple carbs or sugar, it typically suppresses your melatonin production and it blunts your nighttime body temperature from dropping and enabling it to fall asleep. So it's actually stopping you from actually going down in temperature so that you can actually go to sleep. And you have to be at a certain temperature in order to fall asleep. So again, the rule of thumb that they show is that you should stop eating anything that's heavy, fat, or spicy, 2 to 3 hours before bedtime. But they did say that sometimes we have some people who actually wake up because they're hungry. And so there is something to be said about having a little bit of a light snack before going to bed. And that's particularly true for people who have blood sugar issues. So if you have a small balanced snack beforehand, it can help you prevent your nighttime hunger. It can also help you with hypoglycemia. So the foods that they say that help to promote sleep are what they call tryptophan-rich foods. Everyone's heard about how turkey actually can make you fall asleep. It's actually true. Dairy, also oats, complex carbs, something like a whole grain toast or maybe a banana, something like that. Magnesium or calcium rich foods like almonds or yogurt, and then like herbal teas that don't have any caffeine in them. Chamomile, passion flower were the things that they recommended. So if you tend to be somebody who needs a little something, these are the types of foods that would probably be more helpful for you than the other types of foods. Okay. Dr. Leo, and my favorite thing is travel. And that really, really does a number on our circadian rhythms, especially when you're changing time zones. So the rule of thumb is in order for you to recover from any time zone, you need one day to recover, 24 hours for each time zone that you change. So if you go from Chicago to California, that's two time zones. That means it takes you 2 days to recover in California. And then when you come back to Chicago, it takes you 2 days to recover when you're back in Chicago. They say that going from east to west is actually more difficult for your body to get back onto the circadian rhythm properly than it is from going west to east. Obviously, the more time zones that you cover, the more jet lag you're going to experience. And what can actually impact how you actually respond to the time zone changes and how your circadian rhythm can come back into normal function again is also things like cabin pressure, altitude, whether or not you're hydrated, um, any stress that's exacerbated from the jet lag symptoms as well. So there's a lot of different things that travel can actually do to your body that kind of sets off that circadian rhythm. So one of the things that they talk about is a better way to adjust to this whole thing is before you actually travel, if you know you're going to be going east, try to go to bed and wake up a little bit earlier each day so that you can actually start moving your circadian rhythm in that direction. And if you're traveling west, try to stay up and wake up a little bit later each day. You want to try to make sure that you fly so that you arrive in the afternoon or early evening at your destination because that will help you adjust a lot faster. The other thing they recommend is like having a buffer day where you either arrive a day or two earlier just to give your body a chance to adjust to the time change before you actually go to whatever it is that you're going to. And this is a big one, staying hydrated, drinking plenty of water in the days leading up to your trip. And I will actually add another helpful tip to that as well. It's not just drinking water, it's about making sure that the electrolytes are there too. Lots of times you're just drinking water and just peeing it out, but you want to make sure that you're actually retaining it. So it's helpful to sometimes do like those different electrolyte packets that I think Gatorade and all these Propel and all these different companies do now. So when you're flying, it's a great thing to do. All right, so let me just summarize all that I just talked about. Clearly, the circadian rhythms impact your skin. Eczema is going to impact your circadian rhythms as well. And we can also change our circadian rhythms based on what our everyday choices are. So here are just all the things I just talked about. I think it's really important that we are very aware of how it is impacting us in terms of the nighttime itch, the thermodysregulation, the sleep disruption, as well as any impact of stress. Because when we know what is actually impacting all these different things and making our eczema more so, we can actually have a little bit more control over them or we can understand it better. And then as we know these things, we can make better informed choices. And then that can actually help us better align our circadian rhythms for our skin conditions so that we can go from being good to even better and maybe even to the best possible scenario that we can live based on our situation. And then that helps us live our best and healthy lives. So if you want any more information, feel free to contact me. You can just scan this little QR code. I'll be happy to answer any other questions that you have. And I can also answer questions right now if you have any. So that's it. I'm going to stop my share and I'll open it up for any questions from anybody at this point.
Hi, it's Joanne. I have a question. Can you hear me? Okay.
I
Okay.
can. Hi.
Hi. So as you know, I have eczema and TSW. And for me, I am the most itchy by far right when I wake up. And I don't know if that's because I think, a filaggrin deficiency. And so I just have really dry skin anyway. And overnight, I just, it just builds up that I get really dry. But I don't know if you've encountered that before.
Oh, absolutely. So when I mentioned, you have a lot less transdermal retention of moisture throughout the night. And so it's not uncommon to wake up being very, very dry. You tend to be your driest as the night goes on, right? So that is very, very common. Dr. Leo, do you want to jump in on that?
I agree completely. When you have a deficiency in filaggrin like that, your skin is kind of leaky at baseline. It doesn't hold on to water properly and it doesn't even attract the water because it turns out that natural moisturizing factor is part of the filaggrin breakdown product. So not only do you have a little bit of a weakened skin barrier at baseline, but when that protein breaks down, it acts as this thing called natural moisturizing factor, which is a humectant. It kind of pulls water towards it. So it is tough. And we know that a sizable group of patients, maybe as high as like 17 or even 20% of eczema patients, particularly in certain parts of the world, have this filaggrin deficiency. And it's interesting because it's a very powerful root cause. It's, people often say, what is the root cause? It's like, well, here it's that the skin barrier isn't at its best. But there are ways maybe to push back, of course, with really good moisturizers, with taking L-histidine, the supplement, which is an amino acid. It kind of forces your body, especially if you're only partially deficient in it, it can force your body to make a little bit more and strengthen it. So those are some of the things that we can do. And probably omega fats, like eating like a diet with a lot of fish or taking fish oil or cousins of that, be it hemp seed oil or other types of omegas and essential fatty acids, that may help strengthen the barrier, kind of getting around some of the deficiency.
Should I be using a humidifier every night too, or?
It can help. The biggest thing about humidifiers is that we just have to make sure they stay clean. Unfortunately, I have a lot of patients who start using them and then they get kind of moldy or the room gets moldy, and that can actually work against us. But if you could be really good about it, I think that can help, especially in the winter. If you're in the Chicago area, this is gets so dry, it's terrible. So I think that would be great.
Thank you.
I think we have a question from Kathleen.
Hi there. This is all very helpful information. I'd like to make it more complicated for a minute. Um, some of us have no consistent circadian rhythm. It's random in terms of our sleep cycle, at least. And for some people, that could be because of their work responsibilities, where it's not even just shift work; it's just randomly shifting work hours. For others, it's comorbidities that dramatically affect sleep, something like ME/CFS, and where you just have kind of random hours of functionality and you have to use them when they come. So for those of us who for one reason or another really cannot maintain a consistent sleep cycle, and all the standard sleep hygiene advice is just really not relevant to us. it- what additional suggestions would you make, or references, referrals to information? Is there anything that can be done? Because I totally believe you on how not good this is for my skin, this non-existent sleep schedule. I mean, I may go to bed at 5 in the morning, I may get up at 5 in the morning, and I have very little control over this in order to remain functional and keep up with my ADLs and my IADLs with the disabling conditions I have. But I say for other people, it could be their jobs. It could be the same thing forcing them in that. So would any shifts in your advice or layers that you would add for people
Yeah,
like that?
I'm so glad you asked that question. And this really wasn't to, this was trying to help you understand like why you're having all of these different things and why other things could be impacting it more so than, this is, how we're going to solve it. What I typically do is, I mean, I think sleep is everything, and I'm a big proponent of sleep. And so when I start hearing that my patients are having sleep issues, I mean, lots of times I'm actually adding a lot of uh, ingredients to the formula to help them get more sleep and to, kind of override some of these issues that are happening. But if I find that things are not resolving quickly through the herbs, I do send people back to their GPs and I say, hey, if you can get them to have a really nice sleep with medications and stuff, I mean, I am all for that because it's also part of the healing process. As you know, skin regenerates at night. And so if you're not getting good sleep, then obviously that's not happening either. It's not working to your benefit. So yeah, I always send people back to their doctors. And Dr. Leo, you could probably talk a little bit more about the pharmaceutical angle of that.
Absolutely. I think, there's a lot that goes into this. And I also like to work with primary care as well because it's even kind of bigger than what I'm comfortable with a lot of times. There are so many factors that go into it. And of course, there are even sleep specialists that can also be part of the discussion. And sometimes there are other reasons that are keeping people up. But it's a huge unmet need. And the truth is, for a lot of our patients, we find that until we get their skin better, sleep really suffers. And that's a marker of good skin control if the sleep is actually getting better. So it is confusing and really difficult for a lot of patients.
Yeah. And I would say also in Chinese medicine, I mean, a lot of the issues that you're having with your skin is, this amped up inflammation. And when we're able to bring that down, oftentimes patients are able to sleep again. So there's a lot of different herbs that we use to take care of all these different issues that are causing this inability to sleep. And so a lot of times we think to ourselves, oh, well, we're not sleeping, so we need something for the sleep. But it's actually all these other situations that are causing
Hmm.
the not sleeping, right? So in Chinese medicine, we have a lot of different herbs that we utilize for, bringing down inflammation or trying to get itch to be reduced and things like that so that you can get better sleep. But like I said, if that's not happening fast enough for patients and, we're now going on months and months and months of not sleeping, like I said, I usually refer people back out to their doctors, their MDs.
My general approach is because I can't have it good, I can't have it right, that I have to choose between sleeping well and sleeping at a decent time. And for me, I prioritize sleeping well. It's more important to me that I get a good night's sleep, even if it turns out to be a good day's sleep, than that I stay on a particular sleep schedule, because that just never works for me. But I'm, again, I'm sure that this is not ideal by any means, because my circadian rhythm is random, completely random.
Yeah.
Yeah.
Well,
Antihistamines, the first generation type, obviously they'll knock you out cold, but for those of us who have other illnesses that create sleepiness and fatigue, that's a kind of a heavy price to pay, because they make you awfully groggy the next day.
yeah,
The next,
absolutely.
yeah.
Yeah. Well, when you have this condition, I mean, you're just trying to get sleep wherever you can. And if you have the ability to get it during the day, then, I always tell people just get it as whenever you can. And,
Yeah.
you're in survival mode. You're doing whatever you
Yes.
can to, get to the next day. So I completely appreciate where you're coming from.
Oh, thank you. I had to get something into a chart somewhere, because I fear being in any kind of hospital setting where they're going to try to shove me into a circadian rhythm, which will clobber me. Thank you. This is a great presentation. I appreciate the information.
You're welcome. Any other questions? All right. Well, I guess that wraps it up then. I just want to thank everybody for coming today, and thank you, Dr. Leo, for having me. It is always great to be here. And like I said, if anybody has any questions, you could just email me and let me know.
Thank you so much. I'll post this video up right away, so it'll be online in just a few minutes.
Thank you so
Great.
much.
All
Bye.
right. Take care, everyone. Have a great weekend.